Hey everyone, we all have been to hospital. Let's remember the recent episode of visiting a hospital or a doctor. You might remember the anxiety and the stress that the doctors and the hospital staff goes into, as well as the anxiety that the patients feel, not just because of the illness, but because of the unknowns. When are the tests coming in? When is the appointment going to get aligned? And other things that makes it even harder as well. Hey everyone, this is Parminder Bhatia. I'm the Chief AI Officer at GE Healthcare. And today I'm going to talk about this stress across the healthcare systems which our providers are facing, which has impact both on the hospitals as well as on the patients. Then we'll talk about the unlock, which I would like to call as the iPhone moment for AI in healthcare, which is powered by foundation models, which is really unlocking new possibilities which were not possible before. And then we'll take a glimpse at the future of what does the future look like by combining these technologies, which makes the entire healthcare system not only more efficient, but also more connected as well as human. Let's start about talking about some of the challenges in healthcare. If we have to think across in healthcare or the amount of digital data that's created across the board, 180 gigabytes of data will be created across the globe next year. To put it into some context, if we had to digitalize every book that was ever written, we would have to repeat this operation 3.5 billion times. And 1/3 of that data comes from healthcare. What's even more staggering fact is 97% of data is not utilized. All the clinical decisions are made just based on the 3% of the data, which means there's a huge potential of intelligence that is lost across this data in itself. It means a lot of intelligent decisions that can be made based on the scan to identify if the patient might have cancer in future, or looking into the audio subscription and figuring out if the patient might have depression. Looking into the genomics data and figuring out what would be the future profile for the patient. A lot of these questions can be answered, but right now we cannot answer that because we are not unlocking this huge amounts of data. So looking into across the board why healthcare system is having more challenge. We are seeing aging population. Chronic diseases are on the rise, which is putting more and more stress on the hospitals. Cancer, 1 in 3 people will face cancer at a particular point in their life, which means all the families will get affected by cancer one way or the other. Looking into cardiology, cardiovascular diseases is the #1 cause of death globally. And then we look into the access issue, where 4.5 billion population across the globe does not have access today to the primitive healthcare that's needed. Now, looking at the provider's perspective or the doctor's perspective, when they joined the noble cause, what was the key reason? They wanted to cure patients. But today, they spend most of the time in documentation, where 60% of the doctors spend more time with the electronic records than with the patients. And as we look across these different areas, they are spending more and more time with the tsunami of digital data that's getting created, which is fragmented, which is causing more cognitive overload for these providers, which means every 5 years, 100% of the staff turnover is happening across all the hospitals. Now, let's look into some of the voice from what are the key challenges that some of the hospital staff is facing today.
We just do not have enough resources to be able to manage the amount of patients that we have coming through the door.
300, 400 new patients a year. More and more robust challenge.
The care that we're giving patients is more complex. The patients are generally sicker.
Our emergency rooms are full, the inpatient beds are full.
You have lots of unexpected surprises, and that never feels good.
When I say noise, I say false alarms. The nurse tends to be overburdened by every day.
Every single machine we use will have an alarm on it. And from that comes alarm fatigue.
You have base data, 14, 15 terabytes.
How can a human brain even process that?
Then this data will grow.
We're missing the boat on software integration.
We're not designed to work together.
So how do we deal with that complexity without overwhelming our frontline providers?
Can we get to a point where there is truly zero harm because we have partnered with technology to make a safe environment for our patients?
Now, looking into some of these challenges, what is the potential to unlock? That's where foundation models comes in, and we'll talk about that. AI machine learning has been there in healthcare, but it hasn't seen the adoption as compared to any industries. You look across many other industries like e-commerce, where you can identify the best gift that you can give to your spouse, or the next best song that you can play that will keep everyone happy on the road trip. However, when it comes to healthcare, despite of 1/3 of the world's data coming from healthcare, we haven't seen that adoption. And there are multiple reasons for that. Traditional AI has limited focus, which means it can solve a particular problem looking into an X-ray machine, looking into pneumothorax, looking into a particular cancer or fracture in itself. But it can, for any new model that needs to be built, you need to build that entire model again and again. So there's a limited scope and focus for those things. Healthcare is multimodal. When a physician is looking into a patient, they're looking into the X-rays, they're looking into the imaging data, they're looking into the voice data, as well as other parameters as well. However, most of the traditional AI technologies have been looking into one component at a time. And lastly, building and deploying these models is expensive, where deploying these traditional AI models require a lot of customization, which has increased more and more for the IT cost, causing slow acceleration of these technologies. And then came the unlock, which happened about 2 years back, which is ChatGPT. Now, why is that different than any technology in the past? You've used that for summarizing notes or creating a recipe, as well as other use cases as well. However, there are 3 reasons why ChatGPT or large language models was a big paradigm change than any other technology. This technology is powered by foundation models. A, this technology is multimodal. It started with language model, but it can easily adapt to other areas as well. B, you can easily customize and create different applications using the same components in itself. And C, it's easy to scale across multiple use cases as well. Now, let's go into how foundation models can really transform healthcare. Imagine now if you're able to build a foundation model in healthcare that can understand the medical images, can understand the scans, create the report, understand the genomics data, and really streamline the entire value chain across healthcare. So looking into the first area, how traditional models are different than foundation models. Traditional models are trained on narrow data sets, and they're fine-tuned on a particular task. However, foundation models are trained on huge amounts of unlabeled data, which makes it easier to customize across multiple applications. So now you can create those applications with more flexibility and at a faster pace than any time in the past. Second thing is around multimodality. The traditional models were looking into one particular focus area at a point. However, these foundation models are multimodal in nature. Now imagine combining your pathology data with radiomics features, or combining your gene sequencing with the imaging scan that was done. This wasn't possible 3 to 5 years back. You had to stitch multiple models to work together, but these models don't talk to each other. Now you can have one model that can look across these multiple components and streamline the workflow. And lastly, adaptability. Looking into these foundation models are truly adaptive, which can be applied across multiple use cases. Now, what do we mean by that? Imagine creating a use case or an application in the case of oncology. Now you can extend that use case into other care areas like neurology and cardiology more easily than it could be done in the past. As well as, imagine you wanted to create a new drug or a digital pathway for Alzheimer's. Now you can create that entire application in the matter of weeks compared to years or months that it took in the past. Now let's talk about foundation models. GE Healthcare has been pioneer in building these medical imaging foundation models, where we build industry's first full body X-ray foundation model, 3D MR foundation model. I'll give a couple of points on how these models truly unlock a lot of capabilities which were not possible in the past. If you look into a language model, each word is about 8 to 10 bytes. Each 3D image scan in MR is about 5 GB. So you're talking about the volume of data that is required to train these models. So there's a lot of compute components that are required to build these models. So one of the components that was done in the past was all those 3Ds were sliced into 2D, and most of the medical imaging models are based on 2D, which worked quite well over the last 10 to 20 years, but they're not able to comprehend complex structures which could happen in brain tumor or cardiovascular diseases. However, these models can now unlock those use cases. It can work across multiple use cases. You can do the segmentation of an image. You can generate a report from an image. You can do a lot of other classification components like Alzheimer's and others just using one model versus using 10 different models in the past. And another major reason is that these models are multimodal, which means you can use text along with image and generate these reports, which is a huge automation lift to streamline the workflows across these multiple areas as well. You can search similar images that might be tailored for a particular use case as well. Combining the images with a scan can actually streamline the clinical workflows, which wasn't possible in the past. Here's an example of an ultrasound foundation model that was used for segmentation. We call it SonoSam. Think of a smart camera where if you want to take a photo for a particular thing in interest, you might just click on a screen and get to the area of interest, and now you can take a photo. Imagine providing a similar experience to the physicians where they might be interested in a tiny tumor or an organ of interest, where with 1 or 2 clicks, they can get to that part with minimal number of invasion. And as that part, tiny tumor, moves in the body, they can actually track that along with that as well. So providing these kind of capabilities is possible with SonoSam. Now, how is this model different than any model that was built in the past? It performed very well on a lot of downstream applications. This model was never built on fetal head or maternal health for a lot of those use cases, but it still had 90% plus DICE score. So imagine you're creating an application for breast lesion or breast cancer. You're already starting at 90 plus score versus starting at 0, or 50, which will happen in a lot of the current use cases as well. That's the adaptability. The model was never trained on that, but it is able to learn and adapt to create these digital applications at a lot faster pace than any time in the past. Now, the conference is about future, so we'll spend a couple of minutes talking about what does the future unveil for us. So at a high level, we'll talk about 2 theme areas on how these technologies can unlock a lot of different capabilities. The first is on expanding access to care, and the second is around streamlining patient journey across different areas from screening, diagnosis, to treatment. Starting with expanding access to care. 4.5 billion population is without access to proper healthcare. And if we zoom in specifically for the region, we can see that in North Africa and Middle East, heart disease contributes to 14% of the deaths. And over the next 2 decades, we are going to see 85% more increase in the number of diabetes use cases, which means a lot of these chronic diseases is going to put more and more stress into our current healthcare systems. Here's a technology that kind of provides more of a co-pilot experience, which is available in an ultrasound device. So imagine if you want to get a scan for a particular person, it provides real-time guidance, similar to how a car navigator or a co-pilot provides that experience, where move a little left, move a little right, and now you can get a diagnostic quality image. It has huge implications because now, even with technologists with less training, they can take a diagnostic quality image. You can even expand it to remote areas without having the proper training to be able to use a small handheld ultrasound and take scan and use digital and cloud to bring those components into a central location. This work is actually being done in collaboration with Melinda and Gates grant on how do we expand this to more low and medium income countries as well. Second example is around cardiac MRI. Usually one cardiac MRI can take all the way from 30 to 90 minutes, which means it's very hard to do those MRI scans for kids as well as people who might have disease like Alzheimer's or arrhythmia, where it's hard for them to sit in an MR machine for 30 to 60 minutes or holding breath. That's where we announced Sonic DL, which is a technology that can reduce the scan time by 83% with the same image quality. It has huge implications because now you can get the same quality of scan with 83% less time. So now, if it was 30 to 60 minutes, you can do the same thing in minutes, which opens access to a lot of patients with Alzheimer's or arrhythmia who could not be put into the MR machines in the past. It's also beneficial for the hospitals because now they can go through a more throughput of patients in the same amount of time than they could do in the past as well. And now talking about AI in the patient's journey. Cancer is hard, but healthcare system makes it even harder. Physicians today have to spend huge amount of time to get up to speed on the patient history, where for a new patient, it can almost take up to hours for them to get to the right information. They have to streamline this multimodal data and surf through lots and lots of unstructured data to get to the patient information. Based on the survey, 100% felt frustrated with the current system, and only 14% felt that they had looked into all the data to make a good decision for the patient. Now, in a lot of these use cases, tumor boards are set up, which is a group of experts who will come together to look into a use case and see what is the best treatment option for a patient that can be streamlined. However, it has its own challenges. You need to bring a lot of experts together, care and coordination. It takes a lot of time, which can further delay the process. And here, time is of essence in the case of cancer. Data management, bringing data together is also a challenge. And then lastly, the cost, because people have to manually come together, and it's a time that's taken away from patients, but actually getting the meeting done. Now, can we reduce these number of meetings, but have physicians spend more time with the patients to really streamline those workflow? And that's when we looked into one of the use cases of how we can actually streamline this use case of creating a longitudinal view for a patient which is more oncology specific. They can summarize the patient data using AI and look into how the patient is tracking with time as well. They can look into the deviations. Has patient missed any lab results or others, and look into what is the best care coordination that can be done across these different areas in a more confident manner than in the past. Now, all of this is reactive. Now, how do we make or use AI which is more proactive? That's where agentic AI technologies become super critical on how can we look and solve these different problems. So we applied agentic AI into one of the hardest problems in cancer, which is disease progression. So what cancer is doing at a particular time helps to decide what is the best treatment option that needs to be taken for the patient. In a lot of these use cases, you need to combine data that comes from different areas. You're looking into pathology biomarkers, you're looking into genomics biomarkers, you're looking into molecular data to come out with a decision. And that's where you set up a lot of tumor boards to understand and identify these use cases. Health Companion is one of the first AI-powered agentic technology that we announced last year, which actually combines these multiple agents together, where each of these agents look into their particular components, and then they provide the signal to what we call as a coordinating or a supervisory agent to come out with a best treatment action plan. So that's where some of these technologies on how they can be combined can really streamline the workflow. The whole idea behind using these technologies is to augment physicians so that they have more informed decision to parse through the data so that they can make a best clinical outcome as much as possible. Now, how is this technology different than anything in the past? We have looked across clinical decision support, which will give a signal, patient has cancer, patient doesn't have cancer. This is different because A, this can explain what's happening. It can provide inputs and reasoning, which is a core component as to why it came out with that prediction. And C, it can also say the data that is missing. It can also inform if I have more data on the clinical trials, my information can be better suited. So think of this as a companion who's helping physicians make more informed decisions and getting up to speed on the data in healthcare that is increasing every day. Now, I'll end the talk by going through one of the use cases. What if a physician can create a report leveraging these foundation models that can really be streamlined? After that, once the report is created, this agentic AI technology is powered, which will look into all the patient history and come out with the best treatment options and recommendation. And then it can actually look into different bottlenecks. If the MRI scan needs to be done, what needs to be unlocked to get the patient to the treatment as soon as possible. Because the future lies in creating a system which is more interconnected as well as proactive versus being reactive. Thank you so much.